From the outside, Royal Jubilee looks the same as usual. Inside, though, advocates say healthcare workers are overwhelmed.
We already had overcapacity without COVID, and now we're even more understaffed. And now we have these influxes of COVID. So we don't have the person capacity, the human capacity to be in the scenario that we're in now.
For a year and a half of this pandemic, doctors and nurses have been stretched. And now with the influx of unvaccinated COVID patients, they're running out of steam.
We are close to capacity in terms of our designated COVID ICU area.
Dr. David Forrest says at Nanaimo General, right now 10 out of 11 COVID ICU beds are occupied. The last few days seeing a continued rise in patients. And they're not just islanders. Other hospitals in BC are strained as well, meaning patients are being flown across BC to get the care they need. In Victoria, doctors and nurses flagging that Royal Jubilee's hospital COVID ward is also full, but many unwilling to speak to Check News on camera.
What are nurses and doctors fearing when they come to speak to the media?
They are 100% fearing being reprimanded by administration at the extreme end, and it's not a small amount of them are worried about losing their jobs.
The doctors who are speaking say something needs to change.
I am very worried about the capacity in the healthcare system as a whole to continue functioning optimally. I think Mr. Dix and the government recognized that there was this potential, which is why we were unable to provide assistance to Alberta. So I think that the planning is already underway for how to manage this.
No word yet on any orders, so this doctor is resorting to pleading.
Please get vaccinated.
To reduce the current transmission and help healthcare workers get through the next few months.